So we often get asked, how do I get started with my Tempdrop and how do I wear it? So we're going to specifically cover that today, how to use and wear your Tempdrop. The good news is there's lots of support available. Even within the Tempdrop app, if you open up the main menu, you can select help and FAQs, and there's a section in there, how to set up armband, and it has a section with step-by-step with text and graphics to show you exactly how to do that. Then we also have a fabulous Facebook community of around 12,000 women, some of whom are seasoned charters, very experienced with Tempdrop, are also fertility awareness educators themselves. We also have clinicians and fertility doctors in that group. And we also have people like yourself who are just starting out and who have lots of questions about what they're seeing on the chart, what their fertility tracker is telling them. So this is a great place to ask those questions. But today I'm going to cover specifically how to wear Tempdrop. So Tempdrop is worn on the upper arm and it's over the auxiliary artery. So that's that soft little piece that you see between the two muscles on your bicep, if you have muscles. Like me, you may be missing them, but you should still be able to find that soft piece of flesh, and that's where your auxiliary artery sits. And it's a great place to get a temperature reading without having to do oral or vaginal temperatures. So you're going to take your Tempdrop sensor and make sure that it's set correctly. Mine has the extender on it, which just consists of essentially bra strap clasps to make it the right size for me and make sure that it's comfortable. You want to make sure that when you put the Tempdrop on, that it's snug enough that it sits against the skin so that the sensor is taking its readings. You can see my Tempdrop is in there. But not so tight that it becomes uncomfortable. So what you're going to do is make sure that you slide your Tempdrop on with the tip of the sensor pointing upwards. This is going to face towards your elbow. So we're just going to, now it's all set up at the right size, we're going to slide it on like so. And you can see it's snug, but not too tight. It's still very comfortable. It's quite close still to my armpit, but it sits nicely over the artery. And you can see the tip of the sensor points up towards my elbow. So now I'm ready to wear it to go to sleep.